Hey everyone, today I'm going to do an update on ivermectin use in cancer. I found a really cool paper, more recent paper than the last one I discussed. I think it was from 2024. And the title of the paper intrigued me. It said something like, is it time to repurpose ivermectin in cancer use? So clearly, I was really interested in this. Obviously, I know that many of you are interested in the concept of ivermectin use for cancer treatment. And I wanted to give you information from that paper, plus warnings that have been provided, okay? In terms of toxicity, I've been talking about how safe ivermectin is in terms of its use. Today, I'm going to go on the polar opposite, and I will tell you what I've managed to study in terms of the toxicity profile, under what circumstances and when is ivermectin use toxic, okay? So let's get started. My name is Dr. Mikola Rashek of Merogenomics, and let me give you the breakdown. So in terms of this paper, I'll discuss several papers today. The first one in terms of the repurposing of ivermectin in cancer use. Don't let the name deceive you. This is really interesting what the authors did. First of all, it was done by what I think was Chinese scientists, but it was published in like obscure Polish paper, which sort of shows you how difficult this topic is in terms of general acceptance in the scientific and medical community. It just seems to be like when it comes to ivermectin, and its use in cancer, it's a huge taboo for whatever reason, despite the fact that there is strong evidence of its potential utility from a lower case studies, if I can phrase it like that, from the initial studies. True, the initial studies can often turn out to be misleading and you need clinical trials, but we have a giant deficit of that information, and that's unfortunate, and I'll be talking about that as well. There's a tiny little frog by my feet. Anyway, so what the authors did is they decided to look at information that has been published in the last more than 40 years. So they decided to investigate literature all the way from 1980 till 2022, because of the year that the paper was published, which was either 23 or 24. And that was a frog jumping in the pond behind me, if you heard that sound. And incredibly, they found only 26 papers that actually discussed ivermectin use in cancer patients, total of 36 patients only. And the ivermectin in all of these cancer patients that was used was not to treat cancer at all. It was to treat parasitic infections in these cancer patients. So this is the only purpose why they were investigating this. And the reason why they wanted it like this is because they wanted to see what the safety profile is for these individuals. So out of those 36 people, they describe all of the cases and what kind of parasitic issues were encountered and so on. So the paper goes into a lot of detail, but the point is that it was considered to be quite safe. There were no serious side effects, no toxic side effects, and the conclusion of that paper by these authors is that ivermectin can be considered to be quite safe for cancer. Should be considered to be quite safe based on its use for cancer patients to get rid of the parasites. It seems that ivermectin will be very safe as a potential treatment against cancer. Now, let me give you a little bit of information as to how much they use. So the amounts range somewhere between 6 to 20 milligrams per dose. Most frequent dose that they use was 200 micrograms per kilogram of body weight. Or if I can phrase it, that's also, you can rephrase it as 0.2 milligrams of ivermectin per kilogram of body weight. This number will be very important when we'll start telling you everything in terms of the toxicity profile, okay? So keep that in mind. And the dosages included anywhere between, let's say, one-time use to maybe multi-day, and I think the longest number of days that I saw mentioned was maybe 10 days. All right, so also keep that in mind, which also shows you how incredibly powerful and effective ivermectin actually is in terms of getting rid of parasites, because at times a single dose, single use was enough to treat these patients. And they mentioned, of course, that the toxicity profile is very, very safe. It's been used for decades in humans because it's already been approved for use against parasites all the way in 87. So it's interesting that 40 years later, we might be learning that the biggest parasite of all that maybe ivermectin could be helping against is going to be cancer. So, but we need to get to that point, okay? We're not there yet. So keep that in mind. And while the safety profile is considered to be very, very safe, overall, it can be toxic. And when you overdose on ivermectin, and we'll talk a lot about overdosing, if you overdose on ivermectin, the potential issues is you can get drowsy, you can start vomiting, you can have nausea, you can also enter into coma, and you can even die. And we'll talk about all of that as well in a moment. So stay tuned. All right, so that was against the what they actually did. They also talked about mechanisms as to how is ivermectin potentially working against cancer. And you could summarize it into maybe three major groups and in three major effects. So one of them was that ivermectin seems to reduce factors that help to signaling factors for cancer cells. It can suppress these that allow cancer cells to thrive. So let's see if I can remember some of these. There weren't many. So it can reduce in certain cancers this protein that I refer to as YAP1, YAP1. And when you do that, you can reduce the capacity of cancer cells or tumor cells to proliferate. And another one was you can reduce amount of this protein called, what I refer to as, when I read these science papers, I'll read them in a specific manner. I give them names, and one of them was referred as WNT, WNT. And again, that one, when you reduce it, you can block proliferation, as well as what they refer to as, or not they, when I was reading it, studying this, it can reduce stemness. And what I mean by stemness, and this is why this is interesting, is because remember, by that I mean generation of cancer stem cells. And that is, of course, something that captures my attention or my interest, is because ultimately, at least based on my current understanding, which I'm not telling you is absolutely certain, I'm just telling you how I understand what I study, which, remember, everything I ever tell you in these videos is simply my own interpretation. I'm literally recounting to you how I am learning, and it's always subject to being incorrect, right? And stem cells is what you need in order to really get cancer going in the first place. And even when you have, say, what looks like successful treatments, cancers, obviously, we all know, can come back after time. And my understanding is it's because of the stem cells that can survive the treatment. So this is obviously one that was really interesting for me. Another one is that it can inhibit protein called PAK1, PAK1. That one, I think it reduces the capacity of these tumor cells and their motility, and I think maybe some communication. And then last one was mTOR ACT pathway. AKT, and I've discussed this in a previous video as well. This one is one of those major growth pathways for cancer cells. So there's multiple ways of how these signaling factors, growth factors, can be really reduced by ivermectin. Another one is, another group is that ivermectin appears to be potentially helping to drive cancer cells to death. And one is by inducing caspase release, and I talked about that in previous video as well, and that triggers apoptosis. Whenever you hear the word apoptosis, very cool word, that in essence defines cellular suicide. Cell commits death. So that's one. And the other one is, and it might sound a little bit counterintuitive, it can drive mitochondria dysfunction to a point where the mitochondria just stops working to such a degree that the cancer cells can undergo metabolic collapse. So, which reason why I say that counterintuitive is because cancer cells hijack proper mitochondria function and they drive it towards function that we would not typically see all the time within our cells. That's this, I think, was Warburg effect that we discussed in previous videos. And that means now you push the mitochondria to even further changes to a point that even then cancer, it's not even good for cancer cells. So that was one more. And the last one was transport of molecules that are needed by cancer cells for again proliferation and growth, and it can inhibit this protein, I think it was called KPNB1. I hope I remember the name correctly. I usually don't. And either way, it was like a nuclear transport protein that can transport proteins to the nucleus that are inside the cell, cancer cell, that are important for cancer cell helping development of the tumor. So these are some of the mechanisms, and clearly there is a demonstration that ivermectin from these lower type studies, this is in terms of looking at cell lines, maybe animals, but some of it has also been done in humans, and there has been reports that it has been helping in terms of certain cancers. Glioblastoma was mentioned in literature, I think ovarian cancer, cervical cancer, and certain type of leukemias, for example. There's been reports, enough evidence that we should be looking at this at a greater capacity. We should be looking at this via clinical trials, but unfortunately we don't. And they also summarized that, and they looked, the authors, and remember, this is still fairly recent paper, they looked at what kind of clinical trials have been done throughout history using ivermectin for cancer patients. And they said in entire history that they've investigated, at least from 1980 onwards, there's only been 3 trials. One of them was actually during pandemic, and it was to see whether cancer patients who were infected with the SARS-CoV-2 virus, meaning they had COVID, whether ivermectin would help to reduce the amount of virus in these individuals. So this was not to treat cancers, this was simply to help get rid of the infectious agent. And that clinical trial was terminated because they didn't see a difference between the treatment arm and the placebo arm. So in this context, they did not see a difference. Remember, I also done a huge series, a huge video describing literature that shows, that analyze how ivermectin is helping against COVID-19. And that one, there's many aspects mentioned as to why. But in this case, for cancers, it did not reduce the viral load, which is what they were looking at. So that's one. There was another one where that started in, I think it was Brazil in 2022. And some year. I don't remember, to be honest. I thought it was 22, but maybe it's from a different year. Either way, it was for terminally ill and metastatic cancers, and what the clinicians wanted to investigate is whether they could use a mixture of medications to target specifically all the molds and fungus and parasites and basically all the different bugs that could be causing opportunistic problems inside cancer patients, and whether that could help to resolve the issue when the cancers are already in a really advanced stage, whether that could help. However, nothing has happened with that. So this one right now is labeled as status unknown. So we don't really anything. And there's only one trial that is now ongoing, and this is for the triple negative breast cancer. It's where ivermectin in combination with another anti-cancer medication is used to specifically now treat cancer. So the goal here is to test whether ivermectin could be used in order to help cancer patients treat cancer. And I'm not sure if I already mentioned that's in California. So kudos to California for being the only place in the world at the moment and ever that has decided to look at ivermectin in terms of helping cancer patients. So awesome. In the last video, when I talked about this trial, they were not recruiting yet. And now I can tell you that they are already recruiting for that clinical trial. So this is awesome. Great news. I think that's fantastic. So, and the last thing that they mentioned in this paper that I also wanted to talk about that I thought was really, really interesting. They talked about this paper from, I think it was Ecuador, where the purpose of the paper, the authors of that paper, they wanted to investigate real life use of ivermectin by just regular population. This was a rural population in Ecuador who decided to treat themselves with a veterinary grade ivermectin, and that included cancer. So this is a real life scenario of how people are using it on the streets, if you will, right? So I thought I would mention briefly, did discuss this paper. So let me recount this because obviously I was fascinated about this. So in that paper, they interviewed, unfortunately, only 49 people, so not many. And out of those, approximately 19% were using ivermectin for helping themselves against cancer. Now, what turns out from the interviews of these people is that approximately 83% of them consider ivermectin as a panacea or a medication that is good for absolutely everything. So whatever condition, whatever issue they had that you can imagine, their go-to medication is always ivermectin. I'm gonna switch hands. Oh, maybe not. I see I'm getting a sun. Oh well, let's deal with the sun for a moment. Very, very fascinating. And why is that? Is because of the fact that ivermectin is very cheap. So they were using it as a easy alternative to expensive chemotherapy, and word of mouth in the rural communities of success stories. So literally it's the people telling each other, hey, this works great, use it. And that's how that ended up being used amongst that population. And 81% of them reported what they define as success stories. So they were pleased with the use of ivermectin for any of a variety of conditions that they were using it. And in the original paper, they list these different conditions, literally whatever issue they had, boom, ivermectin use. And the paper also mentions that about 40% of them didn't even know that this veterinary medication that they were using is actually antiparasitic medication. So it shows you that it's more people telling each other, use this medication without, and people were using it without even necessarily knowing what it is for. And now that I mentioned antiparasitic, I should have also mentioned that when you take ivermectin, the side effects that you might experience, they typically are transient. They occur within 20 to they may last 20 to 48 hours. And this paper that investigated against cancer patients mentioned that the reason why you see these side effects of ivermectin is typically your body reacting to the parasites that are being killed inside your body by the ivermectin medication. So that's what you're reacting to. That's what the side effects are all about, okay? All right, but the paper from Ecuador, I looked at the original paper. They also looked at the toxicity as well. So I thought that that would be worth mentioning. And they also didn't just interview the people who are using it. They also interviewed local doctors and oncologists. And the outcome there is that oncologists were like, well, this is not an official medication for cancer, so they recommend don't use it, don't touch it until we know more, and we need clinical trials to understand this fully right. But clearly people are like, all right, that's cool, but I'm gonna go to my horse to get a ivermectin prescription. So people are obviously doing what they want to do, which creates a somewhat dangerous situation potentially. And the dangerous situation is potential overdose. And the paper from Ecuador mentioned human toxicity studies. And I wanted to tell you a little bit about that. So remember the amounts I mentioned at the beginning of the video. So what about the toxic studies? So in the amounts of 0.05 to 0.4 milligrams per kilogram of body weight, that is considered to be non-toxic and there won't be side effects. So this is the standard dose that we're seeing used right now in medicine, right? Remember I mentioned 200 micrograms per kilogram was the most frequently used dose for cancer patients. So that's another way of saying 0.2 milligrams per kilogram of body weight. And that's a safe standard medical dose, right? Now, if you go into dose between 6.6 to 8.6 milligrams per kilogram of body weight, so substantially higher already, this is where you can get toxic side effects. And that can include vomiting, nausea, tremors, blurred vision, super dilated pupils, lack of coordination in your movements, and even coma. All right. And once you get to the dose of 24 milligrams per kilogram body weight, that's considered toxic. Awesome sign. I don't often see a road sign like this. So that's based on human studies, all right? But they also mention in the Ecuador paper, but listen, a lot of people, they were using veterinary grade medication. So ivermectin that is obviously made for animal use, and they're warned in that Ecuador paper, be careful when you do this because that could be toxic to humans, because there could be other things inside such an animal medication that is not good for humans. And they mention certain solvents and so on. And I wanted to give you one more. You might dismiss this because I know many of you are using veterinary ivermectin. See, someone is cutting wood, so I'm gonna turn around and get out of here. So, because it's gonna get too loud. I know some of you are using it. I see it from the comments, right? Like, and okay, I understand what is going on. People cannot get their hands on ivermectin, which is made for humans. I think that's unfortunate, and that's a shame personally, because people are now experimenting with veterinary ivermectin. So then let me give you an example of a published example of veterinary grade ivermectin that somebody used that turned out to be where they overdosed, and that was toxic. Okay, so this individual is a case of a 60-year-old who was non-vaccinated and wanted to use ivermectin prophylactically. In essence, they wanted to, against COVID. So they wanted to make sure that they protect themselves against the SARS-CoV-2 virus infection. All right, and they took a huge amount. In essence, they took what turned out to be 5.4 milligrams per kilogram body weight, which for this individual would turn out to be 740 milligrams of ivermectin total. Huge amount. So just something that is obviously toxic. And within an hour of ingestion, this person started to feel dizzy, started vomiting, and then became eventually, down the road, they became unresponsive, and their breathing became depressed. So they had to be taken to a hospital, which is obviously how we know about this case. And what happened is she had to be intubated because she had too much carbon dioxide in her blood and too little oxygen in her blood because of the fact that she stopped breathing properly. So she had to be intubated, and she was intubated for 2 days. And then her breathing recovered. She didn't have any other major issues. So like she didn't have seizures. Her electrolytes were okay, and so on. So 2 days later, she was able to recover, and she also had to be treated for aspiration pneumonia, which basically means lung infection, but aspiration meaning food or vomit was getting into her lungs. That could be because of the fact that she was losing capacity to properly breathe, or because she was intubated, so she had to be treated for lung infection, and in the end she ended up being in a hospital for 4 days but recovered. So I wanted to give you an example of, I've seen videos where people are like, they just take the veterinary grade ivermectin, a tube paste, they squeeze out a paste, and like, yeah, you can just take it, bro, no problem, no worries. And it's not true. You have to be very careful. This stuff is not inert, and you could easily go into a danger zone. Now, the paper also mentioned that what happens there is that in these very high dose quantities, and I will stop here because there is a big spider web behind me with a spider. I don't know if you can see it. No, you probably won't be able to see it. So I don't want to wreck it. Oof, I'm already in a spider web. I'm out of here. And what happens is their ivermectin probably breaches the blood-brain barrier at these super high doses, like what this woman took. And they mention other examples as well. And they mention an example of someone who attempted to commit suicide and took ivermectin, attempted to commit suicide with ivermectin. They took 15 milligrams per kilogram of body weight of ivermectin. So even higher than this woman, and that person ended up being in coma for 3 days. And one more person who took 7 milligrams per kilogram of body weight, and they were severely disoriented as well, and it took a while for them to recover. So these are examples, and they also of what happens if you accidentally were to take too much. It can be dangerous because of that fact that these authors suggest that the ivermectin which normally would not cross the blood-brain barrier. It can overwhelm the blood-brain barrier and start getting inside to your brain and start causing these neurotoxic events. And they also mentioned that when you study the poisoning call centers for ivermectin, about 1% of these are indeed severe conditions. And they brought up an example from Oregon, a poison call center. Of the 21 cases that were used as an example of like more severe consequences, it included, these are the amounts that people poisoned themselves with, and it included 7 to 125 milligrams of veterinary grade paste, 20 to 50 milligrams of veterinary grade liquid solution. So these are the amounts that people poisoned themselves with, as well as one person who took, I believe it was 20 or 21 milligrams of ivermectin, which was human tablets. So they were made for human use. So it just shows you, like, it can even be on a lower end side. Like 7 milligrams would seem to be like a safe dose, but yet somebody had an issue. And I'll explain that as well in a moment as to why you could even have issues with lower normal standard doses. And out of all these people, I think it was 6 needed to be hospitalized. 1 ended up, for example, having seizures. Now, why would anyone else suffer from toxic side effects to ivermectin even at the lower end normal human dose? And it's because the article also mentioned that some humans have genetic mutations that allow easy transfer of ivermectin via the blood-brain barrier into the brain, and they could just experience toxic side effects with normal standard doses. So that's it. I wanted to, this turned out to be a little bit longer, but I wanted to give you a deep analysis of why ivermectin could be toxic if it is not used correctly, and clearly give you a proper warning that think twice before you choose to use veterinarian grade ivermectin or ivermectin that is made for animals. There could be other compounds in there that could be considered safe for animals, but they could be toxic to humans, although these toxicities that I've described simply usually because of the fact that people actually overdose on ivermectin. So keep that in mind if you choose to do this. Now, the final conclusion is clearly we need clinical trials here. The only issue here is that obviously Big Pharma likes to have cancer medications that cost $100,000 a pop, as opposed to ivermectin that's going to cost you $1, right? And who's going to be funding this? But ultimately, the way I see it is that people who choose to take this off-label medication or veterinary grade medication, and I will do another video giving you another example of this, they are taking personal risks, and you can either consider them stupid or you can consider them brave. They are doing some form of service to the world, to the public, by willing to take the risk in order to inform the public as to what happens to them, and when they're choosing to experiment on themselves. And that's their personal decision. They are allowed to do this, right? But it's the doctors that then should be doing something with that information, and they should not let it go unreported. And that does not just include reporting the toxicity events, it should also include reporting the success stories. So if you're a doctor and a patient comes in to you and tells you, hey, I treated myself with ivermectin and now you can see that I no longer have a cancer. Well, I think it's a moral duty and also scientific duty to start reporting these case studies. And the reason why is because it's only then, if these are being reported in enough amount that this is the type of process that will push scientists and clinicians to start looking at ivermectin as for clinical trials. And ultimately, this is what we really need, because that's how you establish how is it safe, and does it even really work if you do proper clinical, blind clinical trials. Without that, medicine can now forever claim, oh yeah, this hasn't been tested, so it's not safe, or we don't know how to use it, and people will continue to experiment, because ultimately, look what's happening. People will do what they hear from their friends or family in terms of what the success story was. If they are left to their own devices and they feel like there's nothing else to do and they got nothing to lose, they will experiment. And without doctors reporting on the success stories, we're not going to get these clinical trials. And only then can we actually get clinical trials on something that is currently very, very cheap and has a history of being quite safe. So why not find out what it can do to us, to the population of cancer patients? All right, I'm gonna say bye here. Please give a like, please subscribe, please leave a comment, please check out my Patreon account, where other stuff also comes out that doesn't make it into YouTube. And the reason why is because my Patreon members, supporting Patreon members, always end up voting as to what gets to be selected for YouTube videos versus not. And I'll see you guys next time. Bye, everyone.